Hello, Hannah.
Hello.
How are you feeling?
I'm okay.
Okay. So I've got you again at the office today, but it looks like today you're in for some migraines. You've been experiencing migraines recently?
I think that's what it is. I've been having some headache, pain, especially behind my eyes, and I get these little patches of blurry vision that kind of come and go, and then some sensitivity to light. So my primary care suggested I come here to get my eyes checked.
I know the last time you came in and I gave you the cranial nerve exam, just kind of the once over because you've never had one before, everything was fine. So that was about a year ago. How long would you say you've been experiencing the kind of migraine blurry vision?
It's been getting worse over the last 3 months.
Okay.
So I sort of noticed it sort of end of summer. I kind of thought it was just allergies, the season changing, but now it's
still kind of persisting.
Okay. Yeah.
And would you say you notice that it's like more so in the morning when you wake up or kind of at night after a long day? Is there anything that makes it worse?
It's more in the evenings
when
I'm tired.
Okay.
Usually if I'm staring at a computer, it makes it worse.
Okay, so that does make sense. Yeah. And I know you said before that you kind of use the electronics a lot for your day job, so all right. Now, as far as the blurry vision, would you say that you're seeing anything? Like, do you see floaters in your vision? Any kind of like white lights or anything?
No, it's like I feel like I need to blink my eyes.
Just kind of clear a little bit.
But they just don't clear.
Okay, and you don't wear any kind of corrective lenses or glasses or anything? I didn't have that on file. All right. Any difficulty while you're driving lately? While you're seeing kind of the lights? Any blurriness there?
Notice, but I mostly drive kind of during the day when I'm not that tired, so it's a little hard to tell.
And is there anything that you found that you've made it better? Have you been having to take any like over the counters or just kind of rest your eyes?
Yeah, I've definitely laying down, eyes closed, and a hot compress helps.
Okay, that kind of helps. Okay, so
massaging.
If a hot compress helps, that kind of leads me towards maybe some inflammation issues because that could be interesting. All right. Is there any pain or tenderness anywhere? Any like areas that are maybe sensitive or?
Just like around my eyes feels a little tender.
Okay. Top and bottom?
Yeah, it's almost just like right in the eye.
Right, okay. So kind of
like here,
almost maybe behind the eyes a little bit.
Yeah. Okay. It feels like it's coming from behind the eyes.
See.
But it feels kind of sore up front.
So again, that does kind of lead me to think maybe there's an inflammatory issue happening. So just gonna feel around a little bit. I don't feel any spots of particular warmth or anything. Just maybe a touch warm, but nothing. Definitely cooler down here underneath the eye though versus up at the forehead. Okay. Is there any discomfort as I kind of palpate here? Does that hurt at all?
It doesn't hurt. It feels like pressure.
Okay. And how about like here at the sinuses? Does that hurt or tender at all?
A little bit, yeah. Especially like more here.
Yeah. Okay. All right.
Yeah, that's more
so that's right on that like orbital socket, just kind of underneath where it meets your cheekbone. And then how about up here, like right at the brow bone?
No, that almost feels kind of good.
Feels okay.
Like a massage.
Okay. All right. Okay. All right. Any lifestyle changes recently? Any like increased stress or anything that you think could maybe?
I've been working on a different project lately that's been really taxing, and I know I'm not sleeping as much.
Okay.
But I've also increased my exercise a lot.
Okay. So is that like a similar time frame over the last few months?
Pretty much exact. Like
right around the same time.
I made a conscious effort to try and balance out the stress.
Okay.
But I've also been, that means my body's kind of feeling different.
Right. Okay. All right. And are you getting any less sleep, like as far as overall hours per night?
Yeah, definitely, probably like an hour less than normal.
Okay.
So I used to get pretty much 8 hours. Now it's anywhere between like 6.5, 7.
Okay, so the trouble with losing sleep, even if it's like a little bit at a time, so if we think, well, I'm only losing like 30 minutes to an hour a night, so over the course of a week, that's 7 or 8 hours, which is a full night's worth of sleep. So it does kind of add up to be pretty significant, even if you're only losing a little bit at a time there. So definitely would try to prioritize sleep. Obviously, that's easier said than done. I know you're very busy, so if it's all right with you, I'm going to start with a bit of a physical exam. I'd like to I know you've maybe been having some trouble with light sensitivity, so I'm going to try to be sensitive to that.
But right now.
Okay.
It comes and goes with the headache. headaches.
Okay, so are you having any of those headache symptoms right now?
No,
You feel
no,
okay?
no. Yeah, I feel
Okay.
fine.
All right. So I'm going to start by just having a look with my pen light, not shining it in your eyes just yet. I'm just going to kind of have a look around. So you're welcome to either look across or you can close your eyes if that's more comfortable for you. Just going to have a peek here. I want to look around and see if I notice any external swelling. So sometimes if there's inflammation above the brow, then I'll notice a little bit of like protruding here, but I don't see that. And then right where you were saying you were having kind of the most significant discomfort, I do see just a little bit of swelling here. Nothing that's really major. And then right center brow, that looks okay. Also just having a look at the hair around the eyes. Sometimes if there's really bad inflammation, then it can kind of disrupt the follicular cycle and start affecting hair growth of the brows and the lashes, but that's not something that I'm noticing. Okay. So I'm going to ask you to perform an action here for me. I'm going to have you keep your eyes closed. I just want you to open your mouth just kind of lazily. Sometimes that helps reveal a little bit more swelling here, which in this case I do see. Okay, so I'm going to feel here. I want you to close your mouth for me and open. And one more time and open. Okay, all right, you can go ahead and relax. Okay, you can open your eyes for a second. So I do notice just a little bit of swelling and inflammation here, kind of like right where you said it's the most painful. Don't see anything above the brow really. Also don't think that this is allergy related or like seasonal allergies. I know you said initially you kind of maybe thought it was related, but aside from the swelling here, it doesn't, upon palpation, I don't feel anything above the eye. So at this point, I am going to go ahead and take a couple of measurements. I want to see if there's a difference in the swelling between either side, and then we'll move into like a lighted exam. Okay. So this is very cold. I do apologize there, but just got a little pocket of swelling here. So sometimes when we're going through sort of a mental stress, and also you said you've increased physical activity recently, so that could be causing it as well. Our lymphatic system doesn't do as good of a job as draining out some of these fluids. So it looks like we definitely have a little bit more on this side. Do you feel like it's more tender on this side?
I do.
Yeah, okay. So I am seeing a little bit of a difference here. Nothing that's, significant, but definitely noticeable. Okay. Yeah, even on the top there, it is just a little bit different. So I'm going to go in with a secondary tool, very similar. This one is a little bit more, not pinchy, but it is going to allow me to kind of grasp the skin, so don't be alarmed. I'm just measuring just below that orbital socket, so 2 inches here. It does naturally slope as we come down towards the mandibular joint, which is what we like to see. And then on this side, oh yeah, so see on the left side you're only at about 1 3/4 there, so you've got about a 1/4 inch of swelling differentiation on that right side. Okay. And then as far as the actual brow, 2.5 here. That's actually about even, so that's good. Okay. So again, I'm going to have you open your mouth for me just a little bit. Perfect. That increases by about 1/8 of an inch there. about the same on that side, so that's good. Okay, go ahead and relax for me. All right. So lastly, I'm just going to go directly over the eyes. So I'm just going to have you keep your eyes closed for me, right over. Well, that's probably not the most comfortable, I apologize. About 23 and a quarter there. Okay. All right, Hannah, so we can go ahead and move into some of the more physical aspects of the examination. So I think the first thing I want to do is just kind of get a sense for any issues or discrepancies with your visual acuity. Not something I'm really expecting, as you don't typically have issues, but I just want to make sure that it's not affecting that part of your vision as well. So I do have just a very basic Snellen chart here, nothing super, strenuous. At this distance, you should be able to read it pretty clearly. So that first letter here,
E.
Good. And if we jump down,
O-L-C-F.
Good. And then if we jump way down here,
L-T-F-P-H.
Good. And no double vision with any of these. You can read them all pretty clearly. Good. Okay. All right. So I'm just going to use the bottom of this to measure your pupil size here. So let me just open wide for me. A 5 on that left side, and then I'll have you turn just slightly for me. And yeah, about a 5 on that side as well. Okay, so as long as we're symmetrical, we definitely don't want to see a difference in one side to the other. So that's really all that I'm looking for. Secondary evaluation here of any issues with color blindness. Now, we did test you for this in the past, and there were no discrepancies. So if we do see any today, then that could mean that something is awry. So I'm just going to test a couple. Do you see anything here?
I see the number 6.
Good. Test some red and green. Anything here?
The number 7.
Perfect. And here.
42.
Perfect. I'm going to do one more. This time I'm going to ask you to cover your left eye for me. Here.
6.
Okay, good. Very good. It's just testing accommodation there with that right side, and you did really well. Okay. All right. All right, so the next thing I'm going to do is test for your pupillary reaction, so constriction and dilation. We've done this before. This is the part where I want you to let me know if I start to trigger any of those symptoms. So either headache or more severe like a migraine, any pain or tenderness, definitely let me know, because I will be shining the light actually in your eye at this point. Okay. So I want you to just look straight ahead. There's a point on the wall, that circle there. I'll come in first just kind of from the side. Initial reactivity is normal, which is a good sign. Okay, so now I'm going to cover So this kind of mimics that first waking up feeling when your eyes are getting very used to the light. So probably feeling some sensitivity there.
Yeah, there's a little bit of discomfort, but not that much.
And is it again kind of like right behind the eyes? Okay. So now I'm just testing for accommodation. Okay. Did you experience any blurry vision with that?
No.
Okay. All right. I'm going to do a focus test here. So I'm going to have you look at the light for me. And then look here. Good. Okay. And then we'll look at the light here. And look at this point here. Okay, so a little bit of difficulty there with that.
I do get double vision
Yeah,
with that
do
one.
you? Okay. Both sides?
Can we do it again?
Sure. Okay, so I'll have you look here, and then here.
No, just double side on the right.
Okay, so then let's do the opposite. So I'll have you look here, and look here. Any double vision there?
It's not as bad.
Not as bad.
The right is worse.
Okay, all right. So that is telling. I think we're definitely having some isolation of that swelling here. It's definitely affecting the orbital side on the right a little bit more. I'm going to go in with my ophthalmoscope and just kind of have a look actually directly in your eye. Okay. All right, so I'm actually going to start on the left. Is it okay if I move your hair just a little bit? Here? Okay. Just tuck it for a second. Your beautiful curly hair. All right, so coming in, looking directly inside your eye, so I'll have you just open wide and look at that point on the wall. And you can blink as needed for sure. You don't have to keep your eye open. So no signs of retinal detachment or anything on this side. And I'm just going to hold your eyelid up for just a second. Okay. All right. So aside from a little bit of just kind of pinkening of the sclera, I don't see anything super concerning. Same thing on this side. Okay. Just right away, the right side is just a little bit different. I do see just a little bit of swelling in the actual eye itself. Okay, I'm going to do more lighted tests, so I don't want to overdo it with that, but it does look like there's just a very slight variation there. So I'm going to go in with this tool here, give you just a break from the light for just a minute. Now this is very, very cold. I just want to give you a little bit of warning. It can be kind of startling. This is a very flat, kind of rounded tool, so it just allows me to feel for any more pockets of swelling. So should you have any little tiny nodules in there, it'll kind of just indicate me of that, so I can do a bit of a further inspection. So I'm going to start up at the top. It might actually feel kind of good, relieving of some of that tension.
Yeah, it does.
I do feel a little tiny one there. More smooth as we come over towards the temporal region. Any of that pain or tenderness over here?
Not really.
No.
The cold feels really nice,
Okay.
actually. It starts about there. That's
Okay.
more tender.
And I'm not sure if you can feel it, but as we come here, there's definitely a little bit of a bump there.
Yeah, I can feel that.
Yeah. And then it kind of smooths out around here, but definitely just right here, I'm feeling something. Just gonna come down and stop about right there. Okay. All right, so this might tickle just a little bit. I'm gonna go kind of directly over the eyelid, so just rest your eyes closed for me. Nothing there. Okay. All right, same thing on the left side. Okay, and then testing for any asymmetry here. Does it feel the same kind of tenderness on this side?
No, it's not as bad.
Certainly smoother on this side. All right, so we've definitely got an isolated area of concern. So I'm going to test some of your corneal reflexes. So I'll start with something fairly basic. This is going to make you blink quite a bit, so that's kind of what we're looking for. So again, I'll have you just look right ahead. This is actually going to touch your eyelashes. Apologize, I know it is very, very ticklish. Okay. Let's see if we can get a response here. So this is very, almost can't hardly feel that at all. Yeah. Certainly a slightly delayed reaction here on the right side. Tear duct is okay. Okay. Do you feel like your eyes are starting to water at all?
No.
No. Okay, good. I'm going to test that again. I just got a little kind of puff of air here, so. So your right side does have a little bit of a delay. I'm not sure if you can feel it, but not as reactive for sure.
It feels less sensitive.
Do you? Oh, so you don't feel it as much?
Mm-hmm.
Okay. So I'm going to have you close your eyes for me. Yeah, so even with your eyes closed, I'm not getting quite as much movement there. All right, you can open. Feels less sensitive. Okay. I'm going to test a couple things here and just make sure that we're not having any concerns with sensation. So you feel this here, correct?
Yes, I do.
And you feel that here?
Mm-hmm.
Now, I'm not doubting that you can feel something here, but does this feel identical in sensation here?
Not exactly, but it's pretty close.
Okay. So you feel that it's soft and you feel it touching you, but just not
doesn't
quite
feel
the
quite
same.
as intense. Yeah.
Okay.
But it feels the same, just not.
Okay.
Same
So
level.
pressure difference.
Yeah.
Okay. So we can actually test that more specifically here. I've got two identical objects. So what we'll do is I'm going to touch you on both sides. I want you to tell me if the pressure feels the same. So to give you an example, I'm going to have you hold your hand up here. So if I touch you, this should feel the same.
Yep.
This should not.
Right.
Okay. So does that feel the same?
Feels a little more on the left.
Okay.
Definitely. I'm not sure. Can you try it again?
Sure.
Feels the same.
Feels the same. Good. And if we come down here.
Feels the same.
Good. Okay.
Felt a little more on the left.
Okay. So I am getting some very surface level kind of peripheral difference in sensation there. So I'm going to do something far more specific here. So this is fairly sharp. It's obviously, I'm not going to put this like on your eyelid, but just kind of close to the outer corner here. And again, I want you to just tell me if it feels the same. Same sharpness.
Just Just a little bit more sensitive on the left.
And just a bigger surface area here. Same sharpness there.
Yeah, that feels more similar.
More similar. Okay, that's good. And then as far as temperature, does this cold feel the same or different than this cold?
It's colder on the left
Colder
side.
on the left. Okay. All right, so that actually is a bit concerning. Excuse me. You do have a bit of kind of peripheral sensation loss, so just not loss really because you can feel it, but just a little bit of a deficit on the right side compared to the left. So at this point, I'm going to try to rule out if you're having a hypersensitivity on the left or if you're having a lack of sensation on the right side. So what I'm going to do is have you look forward. I'm going to do a test for reactivity here. So you're going to feel me kind of snap near your face. So I'm thinking it's the left side isn't so much overcompensating as the right side really is just lacking, and I do think it's more so related to that swelling. So I'm going to test here. So I've got this card, it just has a bunch of squares on it, and this is a really good way to see if you're seeing any floaters in your vision. So I'm going to have you look at the light, and then I'm going to shine the light at the card. I want you to focus right there in the middle. I'm going to bring that closer to your face. Do you see any dots appear?
No.
Good. I'm going to do that 2 more times. So I've got a blue card. Same thing. I'm going to have you look here. See any dots appear there?
No.
This time I'm going to move it over to the right side. So I'll have you look here. You should still see a dot there. Does more than one dot appear as I move closer?
No, just the one.
Good. Just for safe measure here, same thing on the left.
Just one.
Good. Okay. All right. So that's good. If you started to see kind of floaters or you were seeing lights in your vision, then we could be looking at something more neurological. So that's not as concerning there. All right. So very simple here. I'm just going to have you look straight ahead. You don't have to do anything. I'm just going to bring this in closer to your face. Okay. All right, Hannah, so we've been testing for about 30 minutes. Now I want to just reassess your pain level. So when you came in, you said you weren't really experiencing any of those symptoms. Are you feeling anything now as far as increased tenderness or light sensitivity?
It just feels like a slight increase in the strain behind my eyes.
Okay, all right. Okay, so I'm going to have you close your eyes. I'm going to touch just above your eyelid. I want you to puff your cheeks out for me, so full of air. Okay, so I do feel some increased pressure here as well. Go ahead and release. Okay. All right. Okay, so I'm going to do a last couple of bit of palpations. I want to feel around and see if there's anything happening in the surrounding areas, and then I'll kind of discuss what I think we're looking at. Okay? All right, so I'm just going to feel around, and I want you to just let me know if any of this hurts.
It's a little tender on the temple area.
Tender on both sides or just the right side?
It's worse on the right.
Okay. All right. If we come lower down, is that still tender?
No.
And nothing below the jaw hurts here? What about right along the gum line there?
A little bit on the right side.
On the right side. Anything at the nose here?
It's fine.
I'm going to hold here and have you lean forward. Does that increase pressure at all?
It does, yeah.
It does, yeah. And then backwards, relieve pressure at all?
Little.
Okay. If we turn, does it increase or decrease either way?
It feels worse to turn like this.
The turn's okay. It's just straighten that way. Okay. All right, Hannah, you can go ahead and open your eyes. Okay, so as far as the physical portion of the exam, I think we've kind of tested out everything that we need to. So what I'm thinking is happening is that there's no like neurological, deficits happening. You're not having like a strain or any stroke symptoms or anything like that. I do think it's a couple things that could be maybe mitigated with some lifestyle changes. Now, whether or not that's capable is kind of, easier said than done. So obviously we want to kind of minimize any electronic usage, whether it be laptop or phone, whatever it is that you're using the most. Would also recommend putting like a screen protector over your phone. They have darkening ones just so the blue light isn't affecting your eyes as much, because that could be part of it. And then the sleep is where I really think we need to push to kind of get your eyes a little bit more rest.
Yeah.
If you can take some breaks throughout the day, even like step away from the computer every 2 or so hours. I also would like to refer you to our migraine clinic. So we have a sister clinic that works with us. I do tend to refer some patients there. The doctor there can kind of do some specialty testing, see if there's anything in clinic that can kind of relieve some of your symptoms, and then anything that you can follow up with at home if that's something that you're open to.
Yes, absolutely.
Okay, sure. So if you have some time today, I can send you over. Otherwise, you can head over to the receptionist desk and Cindy can kind of get you scheduled.
I can do today.
Okay, perfect. So let me go ahead and walk you over there and we'll see if she has any availability and we can go ahead and get you in now.
Thank you.
All right, thank you so much.